2531 Burke will not be heard today. We have two consent items. Item number 1, SCR 134 Pan. Item number 6, AB 2325 Bonilla. I believe we have a quorum at this point. Let's go ahead and establish a quorum. Call the members, please.
Hernandez?
Here.
Hernandez here. Wynn? Wynn here. Hall? Mitchell? Monning? Here. Monning here. Nielsen? Nielsen here. Pan? Here. Pan here. Roth? Here. Roth here. Wolk.
Okay, we have a quorum has been established. Can someone make a motion on the consent calendar? Moved by Senator Roth on the consent calendar. Call the members, please.
Hernandez?
Aye.
Hernandez, aye. Wynn? Wynn, aye. Hall? Mitchell? Monning? Aye. Monning, aye. Nielsen? Nielsen, aye. Pan? Aye. Pan, aye. Roth? Aye. Roth, aye. Wolk? 6.
That's 6. I think that's everybody's going to be here, right? Oh, okay. Also, Senator Hall and Senator Wolk will not be here today. We'll put that bill on call. We have one absent member, one member that'll be showing up. Okay, we're going to move on to, that's enough to get out though. We're going to move on to item number 2, AB 59, Waldron Mental Health Services Assisted Outpatient Treatment. Good afternoon, Assembly Member.
Thank you, Mr. Chair and members. I'm here to present AB 59, which will extend the sunset date for assisted outpatient treatment statutes for an additional 5 years. This bill continues the authorization of court-ordered assisted outpatient treatment for those individuals who are mentally ill. Assisted outpatient treatment increases treatment adherence, such as medication, and is proven to keep those individuals out of crowded emergency rooms. Currently, Lora's Law, as it is known, has been implemented in Nevada, Contra Costa, Orange, Mendocino, Placer, San Francisco, Los Angeles, and Yolo County, with San Diego recently passing a resolution. AB 59 is a bipartisan bill with strong support from the community, including co-authorship by Senator Hall and Assemblymember Susan Eggman. The California chapter of the American College of Emergency Physicians, California State Association of Counties, NAMI, Contra Costa County, Nevada County Health and Human Services, California Medical Association, Urban Counties of California Mental Health Community Coalition, Contra Costa San Diego Regional Chamber, Tenon Health, and California Treatment Advocacy Coalition. Here I have with me Farah McDade, representing CSAC in support, and Tim Madden, representing California American College of Emergency Physicians.
Mr. Chair and members, I'm Farah McDade-Ting from the California State Association of Counties, representing all 58 of California's counties in support of this bill. We're excited to support this bill because Lora's Law, for the counties that have chosen to implement it, has generally been a success. I will note that implementation of Lora's Law at the county level is an option for the counties. And we want to preserve the option for counties to continue to implement Lora's Law by extending the sunset to 2022. Our records, we have several of the large urban counties covering most of California's population have implemented Lora's Law to some extent. We have about 14 counties that either has a resolution or full implementation. What we have found in our experience, and it is short, Nevada County really has been the one that has implemented Lora's Law for the longest because of the tragedy that happened in Nevada County that sparked Lora's Law. What we're finding is when you talk about assisted outpatient treatment, there's a lot of concern about how folks with mental illness will be treated in those counties. What the counties who have decided to implement Lora's Law have found is that it's more of an outreach program where you can start to target and work with and reach out to the folks in your community who are struggling with the mental illness and who are at risk of, in Nevada County, the tragedy was caused by a person with mental illness, but that's not usually the case. Usually the case, what happens is a person with mental illness is injured. And so we find that implementing Lora's Law in the counties that have implemented implemented it have been able to reach out to those folks in their communities that need the most help. So we're in strong support of allowing counties to still have the option to continue to implement Laura's Law or join on board and implement Laura's Law in the way that meets the unique needs of their communities. Thank you.
Anyone else in support?
Mr. Chair, members, Tim Madden, representing the California chapter of the American College of Emergency Physicians. And as the county representative outlined, Laura's Law provides a nice opportunity for counties to have a different program to reach out to this community, to draw them into an established program to get them the care they need. As many of you know, we see a large number of patients coming into the emergency departments, many times on what are called 5150 holds. And as we work with those patients, we find that if they had an option similar to what's available under Laura's Law, they can get into a program that's better suited for their needs. Which would keep them out of the emergency department, which is not the place where they can get the care that they truly need. So for these reasons, we're very supportive of extending Laura's Law, and we'd like to thank the Assembly member for her work on this.
Thank you. Anyone else?
Mr. Chair, members of the committee, Randall Hager for the California Psychiatric Association. We're very pleased to support this measure. It's really necessary for the counties to begin, to continue the good work that they're doing now, and to for other counties to be encouraged to do this. I just would note that, Laura's Law is a treatment gateway for people who have long-term engagement issues with mental health treatment and often suffer repeated crises. They end up in jail, they end up in hospitals, and Laura's Law is an effective solution. So we commend this to you and hope for your support. Thank you.
Thank you. Anyone else in support?
Mr. Chair and members, Julian DeVoris on behalf of the urban counties of California in strong support.
Thank you. Opposition? Questions, comments from any of the members? No, see no questions or comments. There's a motion by Senator Roth. Would you like to close?
Thank you. I urge an aye vote so we can continue helping these patients.
Thank you. Chair is recommending an aye. Item number 2, AB 59, Waldron. Call the members, please.
Hernandez.
Aye.
Hernandez, I. Wynn. Wynn, I. Hall. Mitchell. Monning. Nielsen. Nielsen, I. Pan. Pan, I. Roth. Roth, I. Wolk.
Currently has 5. That's enough to get out. We're going to place it on call. We have a member still going to showing up. And other than that, thank you very much, Assembly Member.
Thank you.
We are going in file order. I think I saw Assemblymember Rodriguez, item number 5, AB 1931, Emergency Medical Services Paramedics Discipline. Good afternoon, Assembly Member.
Good afternoon. Thank you, Mr. Chair and members. I'm here to present AB 1931, enacts a disciplinary oversight system for California's paramedics, EMTPs, that is similar to the system currently applicable to EMT1s and EMT2s. AB 1931 ensures swift and appropriate disciplinary intervention when necessary, but enacts the appropriate safeguards so our EMT paramedics won't be reprimanded twice or more after disciplinary action has been taken against them. Currently, multiple agencies can investigate the actions of EMT paramedics. However, there is no requirement that these agencies coordinate or communicate with each other during the course of the investigation. This bill doesn't compromise any standard of conduct. What this bill does is give every paramedic the right to a consistent disciplinary procedure that protects their due process rights. With me here today and testifying support is Christy Boma, governmental advocate with the California Professional Firefighters.
Good afternoon, Mr. Chair, members of the committee. Christy Bama on behalf of the California Professional Firefighters, pleased to be sponsors of this measure. I looked at the makeup of this committee, and I know that at least half of you were here when the legislature approved the process that applied to EMT 1s and 2s that the Assembly member referenced. It's been in place for 8 years and is found to prove that it is an effective and efficient way to provide oversight to these EMTs. So this bill simply applies that same standard to paramedics, and so we urge your support.
Thank you. Anyone else in support? Is there any opposition? We have any questions from any of the members? We have no questions. We have a motion by Senator Pan. Would you like to close?
I respectfully ask for aye vote.
Thank you. Item number 5, AB 1931, due pass to Appropriations Committee. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Nguyen, aye. Hall. Mitchell. Monning. Monning, aye. Nielsen. Nielsen, aye. Pan. Pan, aye. Roth. Roth, aye. Wolk.
Currently has 6, that's enough to get out, but we have an absent member, and we'll place that bill and call Assembly Member.
Thank you.
Assemblymember Atkins, item number 8, AB 2568, Integrated Health and Human Services Program.
How are you?
Good afternoon.
Hi, thank you, Mr. Chairman. Thank you, Chairman and members. It's my pleasure to present Assembly Bill 2586, and I want to start by thanking the committee staff for working with us on this. AB 2568 would allow San Diego County to be included in a list of counties designated as Integrated Health and Human Services Agency under the Welfare and Institutions Code, beginning with Section 18986.60. San Diego County has used an integrated agency structure for 2 decades and seeks to be included in the list of counties designated as integrated agencies. Having that designation in statute means that there's a greater flexibility for a county to provide a robust array of services, including flexibility specifically between behavioral health services and protective services accounts. In 1996, the Board of Supervisors merged 5 local agencies together into one super agency, merging the Department of Health Services, the Department of Social Services, the Department of Veteran Services, the Area Agency on Aging, and the Commission on Children, Youth, and Family. In early 1998, the Public Administrator and the Public Guardian agencies were also placed into the Health and Human Services Agency. And the result of these mergers means that there's one agency within San Diego County that has authority over a broad array of services, including those dealing with aging and independence, behavioral health, child welfare, public health, and self-sufficiency programs. So bringing these services together into one comprehensive system has enabled the county to provide a more streamlined, effective, and client-focused, which I think is the key, delivery of health services and social services for more than 2 decades. Currently, only Alameda, Humboldt, Mendocino, Placer, and Solano counties have had the integrated agency designation. AB 2568 is an important bill for the County of San Diego because it will ensure the county having greater flexibility in effectively managing its funds and offering behavioral health services and protective services to the public. Mr. Gross is here representing the County of San Diego, and I would respectfully ask for your support.
Well, it's nice to see him finally show up on time to a hearing that he probably was supposed to be here like 5 minutes
comment,
ago.
Mr. Chairman.
But, by all means, go ahead and present.
I'm sorry, Mr. Chair, but I have a hearing problem, so I didn't hear anything you just said. Thank you, Mr. Chair. I appreciate it.
Fall under the integrated agency needs assessment in the County of San Diego.
Yes, ma'am. I need
Well,
multiple
I guess in
assessments.
response, it's probably because of his age that he's having it.
I do want to comment we're the same age, but thank you. Again, thank you, and thanks to Ms. Atkins for carrying this bill. As I think she probably touched upon, San Diego County has been operating as an integrated agency from an administrative standpoint for a number of years based upon the fact that it is a charter county. The real issue here is the ability to combine streams of revenue to be able to meet the needs of the community in an integrated context with the various services that are provided. We worked very closely with Mr. Bain to try to illustrate how that would work and how that fits into previous code sections that address this. I think the bottom line here is that because of realignment in 2011, it's essential that counties have the flexibility to meet the needs of these populations. We are simply taking the second step. We are already administratively an integrated county, and this will allow us to do it from a revenue standpoint. We're also working with the Department of Social Services, who has more technical questions about how this will work going forward, and we will continue that discussion, but we do ask for your aye vote.
Thank you. Anyone else in support?
We're good.
Farrah McDade Ting from the California State Association of Counties in support of the bill.
Thank you.
Mr. Chair, members, Juliana Voris on behalf of the Urban Counties of California in support.
Thank you. Opposition? Questions, comments? Seeing no questions and comments, we have a motion by Senator Roth. We're at item number 8, AB 2568, due pass to Human Services. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Nguyen, aye. Hall. Mitchell. Monning.
Aye.
Monning, aye. Nielsen. Nielsen, aye. Pan.
Aye.
Pan, aye. Roth. Roth, aye. Wolk.
Assembly member at 6-0, and I apologize, I forgot to ask if you had to close, but would you like to?
Thank you, Mr. Chairman. Thank you,
I
members.
apologize. Item number 3, AB 1386, low emergency medical care epinephrine auto injectors. Good afternoon. How are you?
Hello, Mr. Chair and members. Thank you very much for allowing me to present AB 1386, which would voluntarily allow businesses, organizations, and other entities to obtain a prescription and to stock epinephrine auto-injectors for emergency use. As we all know, today an estimated 1 out of 13 children and 1 out of 20 adults in the U.S. has a food allergy, considerably a higher number than estimates just but a few years ago. Currently, 47 other states have laws that allow or mandate schools to stock epinephrine auto-injectors. Schools are not the only place where children come in contact with these allergens capable of such challenges. This bill provides liability protections for businesses, organizations, and entities that obtain such usage. And today with me is Bruce Lott on behalf of Mylan to speak in support.
Thank you very much. Thank you very much. My name is Bruce Lott, and I'm the head of state government relations for Mylan. Mylan supports Assembly Bill 1386 and urges the support of this committee. Mylan is a leading manufacturer of generic and specialty medications that currently provides medicines in more than 165 countries and territories worldwide. One of Mylan's subsidiaries markets and distributes one of the several epinephrine auto-injectors that are available in the U.S., and we're committed to expanding access. Food allergies, which can be life-threatening allergic reactions, which can lead to life-threatening allergic reactions or anaphylaxis, are a large and a growing health problem. As you heard, an estimated 1 out of 13 children and 1 out of 20 adults in the U.S. currently has a food allergy. But food allergies are only one type of the allergens that can cause anaphylaxis. Insect stings, medicines, latex, and even exercise are known to cause anaphylaxis in some cases. Unfortunately, over the past several years, there have been several high-profile anaphylaxis-related tragedies around the country, in schools and outside of schools. Deaths in Illinois in 2011, Georgia and Virginia in 2012, California, Texas, and New York in 2013, and Minnesota in 2014 resulted in significant attention to the issue and much discussion on how to best address it. Anaphylaxis to food allergies alone results in approximately 90,000 emergency department visits a year. AB 1386 will build upon California's school access law and lay rescuer laws. It will expand access to this critical medication by allowing authorized entities, including daycare, colleges and universities, summer and day camps, restaurants, theme parks, and other places where children and adults could come into contact with potentially life-threatening allergens to stock epinephrine auto-injectors if they choose. 29 states have passed similar laws to AB 1386. Oregon, Florida, and Rhode Island were the first 3 in 2013 and 2014. Last year, 16 more states passed legislation, and so far this year, 10 states have passed legislation. Mylan would love to work with you, the advocates, the medical community, and other interested parties as you consider this important legislation. Thank you.
Thank you. Anyone else in support?
Devin Anderson on behalf of the American Red Cross in support.
Thank you. Opposition? Good afternoon.
Good afternoon. Members of the committee, Kevin Pedrati, representing the Society of Allergy, Asthma, and Immunology. We have an oppose unless amended position on the bill. In the Assembly, the bill was amended to take out the immunity or the liability protections for those prescribing these products. We would ask the committee that those amendments be put back in the bill. We have experience with this. As you recall, several years ago, Senator Huff had SB 1266, and that bill passed the committee without the liability protections. After its passage, very few physicians, or hardly any, would write prescriptions for these products for schools. Senator Huff then did follow-up legislation, SB 738, which provided these liability protections, and now these products are being provided to schools. We just believe that the purpose and the goal of the bill will not likely be met without these protections, and ask that the committee please amend the bill to provide these liability protections.
Thank you. Anyone else in opposition? Questions, comments? Oh, sorry. Go with ladies first. Senator Nguyen.
Thank you, Mr. Chairman. Assemblyman, I really like the bill, but I do understand the concern that has just been stated. Is there a possibility to put it back in? Because, I mean, you just don't want providers to hesitate. I mean, the goal is to help. But if you're going to have a liability against you, even if you give me the option to do it, I'm not going to do it. So is there a possibility?
Sure. Thank you very much, Senator. I want to be very clear that I recognize the challenge that exists. As we all well know, particularly as it relates to process, this was an issue that was put into place with the Assembly Judiciary. As you know, with process-wise, if we took amendment here, it would be a drill break. And so we want to be respectful of the process. I also want to make it very clear that we've been in conversation with CMA since inception, in which they are neutral on this bill. And so we want to recognize the opportunity, as this is double referred, to address that should it move forward with your support in the Senate Judiciary.
Mr. Chairman. Senator Pan.
Thank you very much. And Senator Lowe, I want to thank you for addressing this very important issue around helping people with allergies, because there's a very short amount of time in which to act. I guess my question, and I know that Senator Nguyen also raised the issue, but my question is, we do have certain requirements on the entities. I think it's appropriate. The entities also have protections. Who is responsible for enforcement or ensuring that these authorized entities actually will follow the plan that they have to have? Do they file it with somebody, or they just keep it in their office, or how do we assure that these requirements are followed that are in your bill?
I'll have to defer to, I don't know if a testimony witness has a response to that particular issue on expertise on that.
If I may, my understanding is that the Emergency Management Agency will have authority, regulatory authority and others over this to enforce the provisions of this.
Okay, so so if I wanted to have an auto injector, let's say I'm a museum and I have a cafeteria and food allergies, right? I want to keep an epinephrine pen, then I know that we have to have a plan here, according to the bill. Then I would actually file the plan with the EMS agency, or do I just have to keep it on premises? I'm just trying to clarify who's responsible for the plan and who's ensuring that the plan is going to be, carried out appropriately.
Yep. My understanding is that EMS will have regulatory authority over it, though that's not specifically addressed in the legislation. It is something they certainly would have the authority to address through regulations. At least that's my understanding of the process.
So, and I just wanted to clarify that my staff had just indicated as such to the clarification of the emergency authority.
So I think this gets actually to the crux of the issue that is being raised by the opposition. And I understand that you originally wrote the bill with the liability protection for the prescriber, because the issue now is that the entity, so I'm a physician, I get approached by an entity, let's say Children's Museum wants to have an epinephrine pen, right? And what happens is that, so right now what will happen is that entity will be protected from liability unless through gross negligence, or I guess willful acts. And suppose in that museum that day, you know, someone has an anaphylactic attack, the people who, let's say, are trained either are not available on vacation that day, something bad happens to someone in their museum. And someone comes back and says, okay, well, the entity's protected, but I, as a prescriber, well, did you do your due diligence? How come you did not oversee the enforcement? Maybe they didn't quite follow the rules, but I don't have the capacity to do that. I don't have the ability. I mean, I'm just the doctor. I don't have inspectors. I don't have someone to go, maybe I could ask them to show me their plan, but I can't prove that they're following it. I have to take it on good faith. You know, they're a trusted institution, they're doing the right thing. And so that inherently, I think, is the issue that we're having without the liability protection. I mean, schools, at least they're more specific, you know, and we even saw with schools. So it's not just merely conjecture. We saw that this happened. So I understand, you know, you're not the one who took it out. So, so I hope that we can find a way to work this out, because I do think what will happen is if we pass the bill, we're still going to have a situation where physicians aren't going to be willing to prescribe, because it's just the risk, you know, you're trying to help somebody. And remember, I'm prescribing to an entity. I'm not prescribing to a person. So the ability to vet, you know, a patient is one thing. You know, you talk to a patient, do a history. Trying to vet an entity is a very different thing. And so what I hope is that, and I know you're working on it, so I want to acknowledge that we can get to the right place on that, and we can maybe have conversations with the Judiciary Committee when we took it out to get to the right place. So I'm going to vote as a courtesy vote, because I want you to be able to work on it. I think it's a very important issue, but I also hope we can fix this, because otherwise we'll pass a bill and we'll still have to do another bill to actually make something happen. So I appreciate your work on it. I appreciate what you're trying to do. I'm hoping we can fix this. We would actually have a workable bill, workable law in the end. Thank you.
Senator Nielsen, I believe had a question or comment.
Well, I understand in order to help the author, we might do more than rhetoric. We could reinsert that provision in this committee. That gives him some leverage to go back to say this House did not agree. Now, that's not often done, but on the other hand, if we're going to really exert our power and authority, that's a better way to go than just to send him on his way and it's all going to happen on good faith. History would show that that's not going to happen. I would not want to proffer a hostile amendment to your bill, though, Assemblyman.
So, Senator Monning, then I have some comments, and I'll kind of hopefully address everyone's concerns. But anyway, Senator Monning, go ahead.
Thank you, Mr. Chair. Well, I appreciate you bringing this forward. I just want to go on record. I share the concerns, and again, as cited, wasn't necessarily your decision to amend the bill. It is dual referred. If it makes it out today, it will come to judiciary, and I think that would be an appropriate place to maybe revisit the immunity question. So I'll be supporting it today. I also sit on judiciary, so I'll look forward to a robust discussion in the Judiciary Committee. Thank you, Mr. Chair.
Thank you. So, you know, obviously, I think there's consensus. There's concern about the protections for the physicians and the liability issue. Also understanding that in the Assembly Judiciary, they took it out. And what I'm not prepared to do in this committee, because we don't have it in the form of in front of you, I would rather not do an amendment at this time, but I am comfortable knowing that in the Judiciary Committee that they are talking to the Assembly Judiciary to make sure that there is some kind of resolution to your concerns. So with that, I'm prepared to support it, and keep in mind that it's our policy committee that deals with the health portion, not the legal portion as well. So anyway, anyone else like to make any comments, questions? Seeing none. We have a motion by Senator Pan. Would you like to close?
Just want to, again, acknowledge the issues that have been addressed here and have my full commitment in ensuring that we have continued the conversation should we have the opportunity and pleasure of getting your support to move it out of this policy committee to the next committee.
Thank you. We have item number 3. It's AB 1386, due pass to judiciary. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen? Nguyen, aye. Hall? Mitchell? Monning?
Aye.
Monning, aye. Nielsen? Nielsen, aye. Pan? Pan, aye. Roth? Roth, aye. Wolk.
Thank you very much, members.
6-0, enough to get out. We'll place it on call. I believe I saw, is that Assemblymember Bonta back there? Yeah, item number 4, AB 1568, Bonta Medi-Cal demonstration project.